Hello YouTube, so it's Taylor and I wanted to do a video on HRT or hormone replacement therapy. So when I first started my channel as Moonfire1777, my most popular video by far was called Hormones and the Like. Well, I want to do a video like that again because I feel like it's important that we have a broad range of perspectives in terms of when people start their transition, and I want to provide sort of a macro perspective having gone through transition for such a long time. I want to discuss sort of the immediate changes that I can remember in the beginning and how I've changed and sort of my hormones have leveled off throughout that time, and what changes I made to my own hormone regimen after SRS, and the recent change that I made to go back on progesterone. Now, with all that being said, I do want to put a caveat out there that I'm not a medical professional and I will not give specific dosages, because I feel like it's extremely important that you are healthy when you go about this process. What I mean by that is, please seek a medical professional. There are options available online to get HRT, but that is not healthy. It's not like trying it on a new dress. And HRT is relative, meaning that it's going to vary from individual to individual in terms of your own needs. So my regimen is going to be different from yours. And also, with estrogen, you have an increased likelihood of developing a blood clot, osteoporosis, and breast cancer. So you have to make sure that you're on the right dosages so that you don't increase your likelihood of developing those things. It's also important to make a lifestyle change as well as a change with your hormones. What I mean by that is, take care of your skin, eat healthy, exercise, and this is the same advice that I would give to anybody else, whether they are trans or cis. It's just important to be healthy. So please do that. Please take care of yourself. Please be healthy for me. So I want to start out talking about my experience and how I got access to HRT, because I was not healthy about it at first. I think a lot of people can relate when I say that when you finally are able to put a name to what you're going through, you want to transition right away. And so for me, I was very impatient and I wanted to start HRT. And so I wanted to bypass the therapy requirement, because that can take quite a while to get the recommendation to actually start hormones. So I was able to find a medical clinic and a nurse practitioner who was able to provide me with hormones. Now, unfortunately, it's not like she wasn't knowledgeable. She was definitely knowledgeable, but this was in 2008. And during that time, especially where I lived, not a lot of people knew about the best ways to approach HRT, so I was a bit of a case study for her. And so after my blood work was done, she prescribed me estrogen and progesterone without the testosterone blocker. And it's important that prior to SRS that you are on a testosterone blocker, because obviously you want to block out the testosterone hormone that can impact you in a negative way. Fortunately for me, I went through my transition very quickly. So I started out with HRT in 08 and 09. And then the very next year, when I turned 21, I had SRS. And then the very next year, I underwent breast augmentation surgery, because even though I saw some breast development, I was not satisfied. And so I wanted to, be helped out in that department, if you know what I'm saying. And I'm very happy with that. So, changes. I'll talk about the physical changes first. So the immediate physical changes that I saw was that my skin cleared up right away. I had not like a ton of acne before I transitioned, but I did have acne. And my skin cleared up. Also, my skin got really soft as well. So that's one thing I noticed. I don't remember how many months into transition I was in to notice that change. So yeah, my skin got softer, my jawline rounded out. And yeah, I haven't undergone any sort of facial surgery, so this is just my face after 8 years of transition on hormones alone. And I'm very happy with that. And really, you can't compare yourself to everybody else, because that's one thing I did in the beginning was I did a lot of comparing. And it's very unhealthy because you start questioning yourself. Do I pass? Or why don't I have, as long of hair as her? Or you just, it's very, it hinders the ability for you to find self-fulfillment and self-love. And that's extremely important to develop as you transition. So keep that in mind. Keep in mind that if there's anything that transition teaches you, it's how to be patient. So yeah, the other thing that I noticed was breast development. And so you do have very sore nipples, and that's because your breasts are growing. Obviously, breast growth varies. It has as much to do with genetics as hormones. And for me, I made the decision that I wanted them to be bigger, so I underwent surgery for that. And the other thing is that fat gets redistributed. And so I noticed that definitely when I was on progesterone, I had an easier time gaining weight. And for me, I don't like being stick thin. So when I stopped taking progesterone and I noticed that I was losing weight, because I lose weight very easily and I hate that. I was 96 pounds for the longest time. And I wanted to gain weight and I wanted to have my fat redistribute properly. And so after doing a ton of research and talking to some medical professionals, I decided to go back on progesterone and cycle progesterone. So that means that I take progesterone the first 10 days of every month. And I'm now 105 pounds. Now, granted, I have also made significant changes to my diet and exercise regimen. I don't do cardio anymore. I do a lot of strength training and that kind of thing. But I guess I'll show you. Keep in mind I'm wearing yoga pants, so don't judge me. But this is my body after 8 years of transition. I guess I'll do a bit of a 360 here. I'm trying to think anything else. Oh yeah, something odd that my mom noticed was that my smell was different. Boys and girls obviously have a different funk to them, not that one is better than the other one, but she said that I do smell different. I smelled different than my brother, for instance. And everyone has their own unique scent, but hopefully you know what I'm trying to imply there. Anyways, the other thing that changes is your brain chemistry. So that's why I think it's important to have a variety of perspectives in terms of transition, because who you are in the beginning of your transition is very different from who you are 8 years into transition. And that's kind of why I have a bit of a problem with Caitlyn Jenner having this huge platform, because she just started. And I don't want to get into that in this video, but it's just important, not to say that I'm any better than anyone else. I just have a different perspective to offer, because when you go through puberty, I deal with teenagers every day. You're extremely emotional. You often sacrifice logic in place of your emotions because you're getting rewired, in addition to developing physical changes. And so you can make a lot of really rash decisions and things that don't make a lot of sense. So thank goodness I've matured, hopefully, and leveled out. So yeah, just expect to be emotional. And I also noticed that when I cycle progesterone, that I am pretty emotional the first 10 days, or that I guess I have a heightened emotional intelligence. And so I'm very sensitive to things, and so I have to watch how I respond and react to people. But anyways, to keep this video from going on too long, I'm going to cut it off here. But I hope you guys are having a great day, and thank you for tuning in. Subscribe and like this video, and I will talk to you later.